Okay, so sorry the knee's not feeling well. What I'd like you to do is take a spoon, take the handle. You could also take a little bit of cream, so maybe something petroleum based or beeswax based, something like a massage cream that's not going to absorb the same way a lotion would. And what you'll do is, that could be like a Vaseline as well. This is a cocoa butter. So what you could do is you could put it on, right? And go ahead, be generous with it. You'll put it on, you'll kind of smear it around the leg, both sides. You could go into the leg. If you have shorts on, you could get a little bit more into the thigh, right? Into the back of the leg. And from there, all I want you to do is you'll take this and you'll gently just kind of like scrape through these muscles. I don't want you to create redness. All you're doing is you're finding areas that are a little bit more tender, more sore, right? They might even feel a little bit restricted. That's really not what I want you to focus on. Just areas that seem a little bit uncomfortable, and just gently work in there, right? About 30 seconds to a minute, then you can switch and you can kind of mold around this kneecap a little bit, right? But find those areas just to loosen them up, right? So we'll kind of spend, we'll say like 2 to 5 minutes there based on how many spots you're finding. But like I said, try not to create a lot of redness. And then from there, what you can do is put something under your knee. This pillow is a little bit too much, right? But what you could do is maybe get like a rolled up towel. And all I want you to do is work on straightening this knee. So you could do this with the leg in an elevated position. The elevation will help get fluid out of there, right? So ice is good, it calms it down, but sometimes it does slow down blood flow, it stagnates things a little bit. So the elevation is good, right? Some of this light gliding will also help. You could also kind of take your hands and you could work up. This is called effleurage, where you're sort of moving fluid out of the knee joint and bringing it back up. You could do that for a minute to 2 minutes. But these quad sets or these knee extensions, you'll hold for about 3 to 5 seconds, feeling like you tighten the quadricep muscle up, and then you'll straighten the knee, right? This contraction of the quad will also help pump fluid out of there. But what you really want to do is, once the knee's bothering you, you really want to get knee extension back. This is the big one. So make sure you tighten, right? Hold for a few seconds, straighten the knee. If you have something under your knee, you can feel like you press it down into the ground. And we'll repeat that same thing for about 1 minute to 2 minutes. You can do those a few times a day. Other than that, when you're sitting, try your best to, on the hour, go ahead and straighten the knee, bend it a little bit, make sure you're moving it. The other thing that can be really helpful is, the bike. So I don't need you out doing long bike rides, but if you have a stationary in the house, what you could do is a little light cycling, 3 to 5 minutes. You could do a little bit longer if it feels okay. But that helps keep the knee loose and will also create some contractions that'll help pump fluid out.